Good morning, everyone. It's November 6th. It's a Monday. How are you doing? My name is Danielle Gorley, and I am the Director of Services here at All For You Home Care. And today I'm going to be doing a training course. This is part 3 of your packet of the safety training of emergency situations. Everybody's getting this packet. And so today, it's part 3, and we're going to go over infection control. So this is for all those ladies and germs out there. Note my pun. We're going to be talking about infection control this morning. So the contents of this, we're going to be talking about the spread of disease and prevention, common bloodborne pathogens, hepatitis B, hepatitis C, human and immune deficiency virus, HIV, and other bloodborne pathogen diseases. We're also going to be talking about other common conditions type as TB, lice, scabies, our policies and guidelines for bloodborne pathogen standard, universal precautions, and procedures for hand washing, gloves, and other personal protective equipment, handling and disposal of infectious wastes, linens, cleaning the environment, and the resources you have. 7-2, these are our objectives. We're going to explain how infectious diseases are spread and a list of common preventative measures. We're going to identify and describe common bloodborne diseases. We're going to identify and describe other communicable diseases and conditions and explain the role of immunizations of direct care workers, also known as home care aides, caregivers. We're going to identify the components of a bloodborne pathogen standard and explain the purpose of infection control, measure, and describe the techniques of infection control. And so the skills that you're going to be learning here today too is proper hand washing, applying, and removing of disposal gloves. Now the key terms that you're going to hear in this training are bloodborne pathogen, confidentiality, hepatitis B and C, HIV, infectious disease, lice, pathogen, personal protective equipment, also known as PPE, scabies, sharps, standard precautions, symptom, TB, transmission, and universal precautions. Who is printing? Was that Jane? Mm-hmm. Alrighty. So we're going to be talking about the spread of disease and prevention. I hope you guys can hear me over that printer. Okay. Oh, it's over. Woo! It's a miracle. So the spread of disease and prevention. Preventing the spread of disease depends on how the disease is transmitted and the source of the infection. Germs, also called microorganisms, are tiny living particles. They can be found anywhere. In the air, on the ground, in our bodies. Pathogens, the germ that cause diseases, often live in a particular environment. Some diseases are spread by touching objects that are affected a person has touched. So that means, you know, when you go to the bathroom and you're leaving the bathroom and you're touching the door handle to open it up, if somebody has left that bathroom and maybe they were coughing on their hands and then touched it, you are now touching something that an infected person has touched. Other diseases are spread when you come into contact with body fluids of an infected person, for example, blood or saliva. Sources of infection are the air, eating and drinking utensils, dressing, food, personal hygiene equipment, insects, water, direct contact, and animals. Healthy individuals with healthy immune systems will stay healthy because their immune system will fight the germs. Dana, just go get your papers. You're so funny. That's our Dana. Say hi, Dana. At least come back and say hi. Here she is. Hi. To help the body fight off diseases, there are simple things you can do every day. You can reduce the spread of infectious microorganisms by washing your hands after urinating, having a bowel movement, or changing tampons or sanitary napkins or pads, washing your hands after contact with any body fluid or substance, whether it's your own or another person's, washing your hands before handling, preparing, or eating food, washing fruits or raw vegetables before eating or serving them, covering the nose and mouth when coughing, sneezing, and blowing the nose, bathing, washing hair, and brushing teeth regularly, washing, cooking, and eating utensils with soap and water after use. Germs multiply rapidly in warm, dark, moist environments, so keep those areas of the person's body, for example, the groin folds, and living organisms shower the corners, making sure that people are clean. So especially this is important when you are bathing a client. Maybe you're giving them a bed bath and they have some, folds. You want to make sure that you're cleaning them properly, but then after you're cleaning them properly, you want to make sure that you're drying them properly to make sure that you get rid of any moisture, because germs are going to grow where it's warm and it's dark. And so you want to make sure that even if your client, maybe they bathe themselves, but when they get out of the shower, you help dry them, making sure that they're completely dry. Making sure that your feet, you're completely drying your feet and in between your toes before you put your socks on. So just make sure we're doing that, guys. Some risk factors. People are at greater risk for getting infections if they have weakened immune systems, such as somebody who's very young or an elderly person. Young children have not yet developed a strong immune system. The immune system becomes less effective as the person ages. This is why very young children, ages 6 months to 2 years, and elderly persons should get flu shots annually. People that are on medications that suppress their immune system, for example, they've had an organ transplant, on prednisone or other similar medications, have HIV or AIDS, and are not eating healthy foods or sleeping enough and are under stress. Wow, that's a lot of us, isn't it? We're all not feeding our bodies right, and we're not all sleeping the amount of hours that we should be. And we do have our daily stress, and we want to make sure that we're taking care of ourselves, because as we learned, in order to take care of other people, we have to first take care of ourselves. So now we're on page 7-4. And we're going to be talking about the common bloodborne pathogens. So bloodborne pathogens are disease-causing microorganisms present in the human blood or other potentially infectious material. These pathogens include and are now limited to hepatitis B virus, which is the HBV, hepatitis C virus, which is the HCV, and human immune deficiency virus, which is HIV. According for the Centers of Disease Control and Prevention, CDC, hepatitis C is the most common chronic bloodborne infection in the United States. Some symptoms are similar to these diseases, but not all. So we're going to talk about some symptoms of hepatitis B and C. So the symptoms would be the patient is feeling flu-like symptoms. They have fever, lack of energy, dark urine, yellow skin, abnormal discomfort. Symptoms of HIV would include flu-like fever, weight loss, a rash, diarrhea, night sweats, and swollen lymph nodes. And then they say, please note here that hepatitis B, 30% of cases had no signs or symptoms. That's crazy. And hepatitis C, 80% of cases had no signs or symptoms. So people are walking around with hepatitis C and they don't even know it. Hepatitis B virus, the HBV, is potentially life-threatening bloodborne pathogen. The CDC estimates that approximately 280,000 HBV infections each year in the U.S. and approximately 8,700 healthcare workers each year contact hepatitis B. And about 200 will die as a result. In addition, some who contact HBV will become carriers, passing the disease on to others. Carriers also face a higher risk for other possibly fatal liver alignments, including cirrhosis of the liver and primary liver cancer. HPV infection is transmitted through exposure to the blood and other infectious body fluids and tissues, and everyone with occupational exposure to blood is at risk for contacting this infection. Just to remind everybody, we are a non-medical home care company, so a lot of the people that are dealing with these risks are going to be home health aides. And so they're coming out, they're doing wound care, they're coming in contact with the blood. And but we all want to make sure that we're safe, because you never know, you may come in contact with blood. But a lot of times we don't. But in case we do, we need to know what to do. Employers must provide engineering controls. Workers must use work practices and protective clothing and equipment to prevent exposure. So that means that whenever you're handling a client with blood, with saliva, you know, you're giving them a bath, or you're helping them on the toilet, or you're changing their linens, then you're going to want to make sure that you're wearing gloves. Vaccination. The new OSHA standard covering bloodborne pathogen requires employers to offer a 3-injection vaccine series free to all employees who are exposed to blood or other potentially infectious materials as part of their job duties. These include healthcare workers, emergency responders, first aid personnel, law enforcement officers, and others. Now we're on 7-5, guys. The vaccination must be offered within 10 days of the initial assessment to the job, where exposure to blood and other potentially infectious materials can be responsibly anticipated. The hepatitis B vaccine is non-infectious, yeast-based vaccine given in 3 parts to the arm. There is no risk of any contamination from other bloodborne pathogens, nor is there any chance of developing HPV from this vaccine. The second injection should be given 1 month after the first, and the third injection should be given 6 months after the initial dose. More than 90% of those vaccines will develop immunity to the hepatitis B virus. To ensure immunity, it is important for all individuals to receive all 3 parts. So that means that every time if you decide to go get this shot, this hepatitis B vaccine, you have to make sure that you're going back for each additional shot. And this is one of the things that All For You Home Care does offer for free, but you got to make sure that you're going to all 3 parts. At this point, it is unclear how long the immunity lasts, so booster shots may be required some point in the future. The vaccine causes no harm to those who are already immune or to those who may be HPV carriers. Employees may opt to have their blood tested for antibodies to determine if they need the vaccine. Workers who decide to decline the vaccine must complete a decline form, and employers must keep this form on their file so that they know that the vaccine status, and everyone who is exposed to blood. At any other time the worker initially declines to receive a vaccine, he or she may opt out of taking it. And so that is actually when we do our beginning orientation, we talk about the hepatitis B vaccine, and then at that time you'll receive whether or not you would like it, or if you want to opt out, and you're signing it. All right, we're going on. Hepatitis C. Who knows what hepatitis C is? If you know what hepatitis C is, feel free to comment below. I want this to be engaging, and I want to have conversations with you guys. So if you guys have questions along the way, feel free to ask any questions that you may have, and we'll love to answer those questions. And if we don't, we'll find someone who knows the answer to that question. So hepatitis C. Hepatitis C is a liver disease. It's caused by the hepatitis C virus, which is HCV, found in the blood of the persons infected with the disease. Hepatitis C can be serious for some persons, but not for others. Most people who get hepatitis C will carry the virus for the rest of their lives. Many do not feel sick from the disease. But most of the persons with some liver damage, eventually, some patients may develop cirrhosis of the liver, and liver failure. There is no vaccination for hepatitis C. Although this was written a little while back, and I think maybe as of 2016, there actually is medication that people can take for hepatitis C now. So we may want to check that out. However, many persons with hepatitis C are not at risk for hepatitis A and hepatitis B and should be vaccinated with these diseases. Preventing the spread of hepatitis C. Hepatitis C spread is through the blood of an infected person. So sharing needles, syringes, and other equipment used and drug use can also help prolong the spread of this disease. You don't want to share razors, toothbrushes, or other personal care articles that may have blood on them. And rarely it is spread through unprotected sex. Hepatitis C is not spread by breastfeeding, hugging, kissing, food or water, sharing, eating utensils, or drinking glasses, and usual contacts such as sneezing and coughing. We're on 7-6. Human immune deficiency virus, HIV. If you are going to be caring for someone with HIV infection, you need to understand the basic facts about HIV and AIDS. Acquired immune deficiency syndrome, AIDS, is caused by the human immune deficiency virus, HIV. People who are infected with HIV may look and feel healthy and may not know for years that they are infected. HIV slowly wipes out parts of the body's immune system. HIV-infected person gets sick because the body can't fight off the disease. Signs of HIV infected are those of many people, common diseases such as swollen glands, so they're having swollen glands, tiring easily, losing weight, fever, or diarrhea. Different people have different symptoms. HIV is in the person's blood, semen, vaginal fluid, and breast milk. The only way to tell if someone is infected with HIV is by doing a blood test. There is no vaccine to prevent HIV infection and no cure for AIDS. There are treatments that can help an affected person live longer and prevent diseases that people with AIDS get often, and the research on this is ongoing. HIV slowly makes an infected person sicker and sicker. Someone with AIDS can feel fine in the morning and be very sick in the afternoon. It can seem like you're riding a roller coaster, slowly climbing up, feeling good, and then plunging down, feeling other illnesses. How HIV is spread. So HIV is commonly spread by having unprotected anal, vaginal, or oral sex with somebody who has HIV, sharing needles or syringes with someone who is infected with HIV, mothers to their babies before the baby is born, during birth, or through breastfeeding. Early in AIDS epidemic, people became infected through blood transfusions and blood products such as clotting factors given to people, or organ or tissue transplants. This was very rare in the United States in 1985, and when it was tested for HIV was licensed. So since then, all donated blood and organs or tissue are now tested for HIV before they're given to a patient. How HIV is not spread. You don't get HIV from the air, from food, water, insects, animals, dishes, knives, forks, toilet seats, spoons, or anything else that doesn't involve blood, semen, vaginal fluids, or breast milk. You don't get HIV from feces, nasal fluids, saliva, sweat, tears, urine, or vomit. Unless there's blood mixed in them. You can help people with HIV eat, dress, and even bathe without becoming infected yourself. Other bloodborne pathogen diseases, there are other diseases caused by bloodborne pathogens, such as malaria, syphilis, and Ebola, but those are much less common than hepatitis B and C or HIV. So now we're going to go to did you know? So number 1, some diseases can spread through the air. Is that true or false? That is true. Children and older adults are more at risk for the infection. True or false? And feel free to put your answers below too, guys, if you want to play along with me. So the answer for that is true. You can get hepatitis B from another person's blood. True. You can get vaccinated to protect against hepatitis B. True. You can get HIV or AIDS in another person's sweat. False. Has to be through the blood. All right, now we're going to go to 7-8. Other common conditions. All right, there are many other diseases that are not caused by bloodborne pathogens. These diseases may spread through the air, perhaps even when someone sneezes. Other pathogens live on the skin or other surfaces, and some conditions are caused by small parasites such as lice. We're going to talk about TB. TB is still a problem. 8 million new cases occur each year in the world. In the U.S., the 30-year decline in TB cases has ended. Since 1985, the number of U.S. cases reported each year has remained above 22 million of people have TB infections and had no symptoms of the disease. So that means people are walking around and they're not knowing that they have TB. They can transmit the disease to others, and an estimated 10 to 15 persons in the U.S. are infected with the TB bacteria. That is why TB screening is needed, especially for those who work in the healthcare setting. Anyone can contract TB, but those at high risk include people living in subsidized housing or homeless, immigrants from areas where TB is common, residents of supervised living facilities or group homes, especially nursing homes, prisoners, people who have immune deficiencies, diseases such as HIV, AIDS, or those who have a recent organ transplant, or IV drug users. Healthcare workers. TB is transmitted through the airborne route. This means that the TB pathogens are in the air and can be inhaled. If you are repeatedly and prolonged exposure, usually to somebody with TB, the disease is not spread through sharing of the belongings that are touching, but it can be spread through the air if you're maybe if you're in a room with somebody that has TB and you're there for a long time. Some of the symptoms of this disease include coughing, fatigue, weakness, fever, weight loss, night sweats, and blood in the sperm. Screening for these diseases is done with a skin test. If the result of the skin test is positive, it means that you have been exposed to the TB bacteria. This does not mean that you have an active case of TB. You will need to seek medical advice to see if you have an active TB. And once you have a positive skin test, you can also get a chest X-ray to see if the presence of the TB, even if you're healthy. And so we at All For You Home Care, we do pay for the cost of TB tests if you don't have one currently from your own doctor. And then you can decide if you want to do the shot or if you want to do the chest X-ray. That's really up to you, but it is mandatory that any caregiver that's coming in contact with clients must have the TB test, and then must every couple of years get the TB test, whatever is regulated by the state. So now we are on 7-9. So we're going to talk about lice. Does anybody know what lice are? Does anyone have lice? So lice are tiny insects that live on humans and survive by feeding on blood. And everybody has blood. When a large number of lice live and reproduce on a person, it is called an infestation. There are 3 kinds of lice infest in humans. There's head lice, there's pubic lice, also called crabs, and there is body lice. Infestations are easily spread from one person to another through close body contact or through this shared clothing or personal items such as hats, hairbrushes. Lice cannot jump or fly. Symptoms: the most common symptom of lice infestation is itching of the affected areas, and symptoms vary depending on which type of lice is present. Diagnosis and treatment: you want to really check for lice. They have live living eggs. This is called nets. It's in the hair and usually is needed to be diagnosed for an infestation called head lice. A health professional may confirm the diagnosis, and there is a lot of over-the-counter medications that you can get to help with the head lice, but it's not an easy thing to get rid of. Public lice and body lice can also be diagnosed with a close visual exam of the affected person's area where the person is itching. Use a fine-toothed, dark-colored comb and comb the person's hair. Nits are usually they look like very small grains of rice. Both lice and nits must be destroyed to get rid of an infestation. The most common treatment is a topical non-prescription or prescription cream, lotion, or shampoo to kill the lice and eggs. Sometimes a second treatment is needed to make sure that all the eggs have been destroyed. When 2 or more topical treatments have failed and to get rid of the lice, a prescription pill may be needed. So you have to seek talk to your doctor, seek some medical advice on what you should do in that situation. All right. If you go to a client's house and you notice that they have lice, call your supervisor to get directions on how to proceed if you suspect that someone has an infestation. Scabies. Scabies are tiny 8-legged mites that are hard to see without a magnifying glass. They dig underneath the skin and cause itching so severe that it may make it difficult for a person to sleep at night. In early scabies, rash will show up as little red bumps. It looks like hives, tiny bites or pimples. Later, the bumps may become crusty or scaly. Scabies usually starts between the fingers and under the elbows and wrists, buttocks, or waist. Sometimes a person will have long red marks to where the mite has been crawling under the skin and the person has been scratching. People in group settings such as nursing homes or group homes are more likely to get scabies. Diagnosis and treatment. Usually a dermatologist will be able to tell if a person has scabies just from looking at the skin. If not, he or she can do a simple diagnosis test. Scabies is easily treated with special creams and lotions. Wash the person's clothes, sheets, towels, and hot water. Dry the clothing and linens completely in the dryer. Vacuum the whole house and throw out the old vacuum cleaner bag. Treat all family members for scabies at that time, whether they itch or not. The scabies to help keep the scabies from spreading. So policies and procedures and guidelines. Direct care workers like healthcare professionals must take precautions to help prevent the spread of diseases and infestations. There are policies and guidelines that describe the actions required and are recommended. OSHA is concerned about the transmission of all bloodborne pathogens and has created guidelines, especially for those preventing and minimizing an employee's exposure to hepatitis B, which is the HBV, and HIV. OSHA regulations mandate the implication of universal precautions in all bloodborne pathogen standards. The Bloodborne Pathogen Standard. On December 6, 1991, OSHA issued its first guideline on occupation exposure to bloodborne pathogens. It is called the Bloodborne Pathogen Standard and explains what agencies have to do to prevent the spread of infections. And the standard covers these topics: exposure control plan, training, maintaining training records, labels, implication and monitoring compliance with guidelines, universal precautions, HPV vaccine, post-exposure follow-up, and personal protective equipment, PPE. Your agency will provide the our agency will provide more information about bloodborne pathogen standard if needed while you're doing your work. So if you guys have any questions, just let us know. When you go to a client's home, they should automatically have gloves. But if they don't, you know that you can get gloves from us here in our training room. We always have gloves and masks available for caregivers, so stop on by, pick some up, but always have them with you. If you have any issues regarding this, you can just call, let us know, ask us any questions that you may have. So now we are on 7-11, Universal Precautions. Universal precautions, sometimes called the standard precautions, are infection control procedures as the DCW. You can use precautions every day, so by washing your hands properly, keeping your work environment clean, and using PPE, which is also known as what, guys? What is PPE? Gloves. Universal precautions are designed to prevent healthcare workers from transferring infections to patients and from infecting themselves. Disease-causing agents may be present in the body substances even if a person does not look or act sick. Therefore, universal precautions should be used whenever you come into contact with body fluids or any other person. The purpose of universal precautions is to prevent and minimize exposure of bloodborne pathogens. To be safe, universal precautions apply to any fluid from the body. Approach all clients as if they were HIV and HPV infectious. Universal precautions apply to tissue, blood, and other body fluids contacting visible bloods. Blood is the most single important source of HIV, BVV, and other bloodborne pathogens in the workplace. Plan ahead when you're working with a client and use the appropriate personnel protective equipment such as gloves, and know the limitations of the PPE you're using, when equipment can protect you and when it cannot. Do not recap needles, do not break or otherwise manipulate needles, and place contaminated sharps in a puncture-resistant container. Wash hands immediately after contamination or removing gloves. Getting a little tongue-tied, guys. Okay, so now we are on 7-12. So now we're going to talk about hand washing. Hand washing is one of the easiest and most effective ways to prevent the spread of infection with proper techniques. When proper techniques are used at the appropriate times when working with clients, it is imperative that all these steps are demonstrated in proper hand washing techniques. So washing your hands immediately upon arrival or beginning with a client living in their home. So that means as soon as you get to shift, you're going to be, hello, it's so nice to see you, clock in, and then go wash your hands. And then before you're leaving the client. Immediately if contaminated with any blood or any body fluid. Before and after you contact with a new client, before and after the use of gloves, after handling any soiled linens or waste, before and after contact with any wounds, and after using the restroom. The procedure for washing hands. Collect all items needed for hand washing. Remove all jewelry on hands, fingers, and wrists. That is what's recommended. Turn on the water and adjust the temperature. Water should be warm but not hot. Wet hands under the running water with fingertips pointed down. Apply soap to the hands. Liquid soap and a pump is best. With fingertips pointing down, lather hands well. Rub your hands together in a singular motion to generate friction. Wash carefully between fingers, palms, and the back of hands, and underneath, under and around any jewelry. Rub your fingernails against the palm of the opposite direction to push soap under the nails, like this. Remember, you need to wash your hands a minimum of 20 seconds. So some songs that you can sing that 20 seconds would be the happy birthday song or Twinkle Twinkle Little Star. How many people sing a song when they wash their hands? Or maybe you just sing it in your head. I don't know. Are you singing it out loud? That might be a little strange, but let us know below. Or what song are you singing? Maybe you're singing a Rihanna song. Who knows? Let us know. Wash a full hand's distance of both wrists as well. So that means if your hand is this long, you're going to be wanting to wash till right here. With fingertips pointed down, rinse all the soap off thoroughly. Dry hands with a clean paper towel. Use paper towel to turn off the water and to open the restroom door if needed, and drop the paper towel in a trash can container. Practical tips. This is 713. Use soap. It breaks the surface tension of the water, making the water work harder. Friction, rubbing hands together, loosens bacteria and dirt. Remember that is friction that kills and loosens germs, not the soap and water temperature. Use plenty of water to wash away any contaminants, dirt, germs, and soap. Do not use chemicals such as bleach or alcohol to wash hands. They may damage the skin. Do not use a nail brush of any kind. They can damage the skin and cross-contaminate. And don't forget, you must wash your hands for at least 20 seconds. Keep fingers pointed down in the sink. Do not allow water to run up the arm or off the elbows. Don't forget to wash your wrist. Remove jewelry and wash under the items. Germs hide under rings and bracelets. And don't touch the faucet, sink, or surfaces or doorknobs after your hands have been washed, because you're recontaminating your clean hands. So on 7-14 is here's some. It says, "Are you washing your hands correctly?" And then it shows picture ideas on how you should be washing your hands. So here that is. But you also have it in your packet that you're receiving from us as well. Okay, so 715, gloves and other personal equipment, PPE. Personal practice equipment such as disposable gloves allows you to create a barrier between yourself and the germs. By using disposable gloves, you are preventing the spread of infectious diseases that are common, like the cold, flu, MRSA, or HIV. Just to name a few, wearing gloves is not just for your protection, but the protection of others as well. Disposable gloves should be worn when touching blood and body fluids. You are an individual caring for someone who has cuts, sores, or other skin openings. There's possible contact with feces, urine, vomit, or wound drainage, or handling soiled clothing and linens, or cleaning the bathrooms. So procedures for putting on gloves: wash and dry your hands following proper procedures. Remove a pair of gloves from the glove box. So don't use something that's already been used before, because you're trying to save some money. Use care when putting the gloves on. If a glove tears and becomes punctured, take it off and start with a new glove. Interlace fingers to remove wrinkles, air pockets, and achieve comfortable fit. And you may want to consider doubling the gloves if your nails are longer, or you're at risk for puncturing the gloves, or the gloves have become heavily soiled. Doubling gloves simply means wearing 2 pairs of gloves. So just to remind everybody, your nails should be sport length, so we shouldn't have anybody with long nails, anything dangling off the nails. So just keep your fingers sport length. That would be great. Removing or disposing of gloves. From the outside, pinch the rubber glove just below the cuff, using your thumb and your index finger to lift the glove away from your wrist. Using the middle and ring fingers, scoop the glove away from the wrist, pulling it inside out. Ball the glove completely into a palm of the gloved hand. So while I'm doing this video, you may want to get out a pair of gloves, and you guys can practice doing this as well. Now with ungloved hands, slide your index and middle finger under the cuff of the other glove. Again, pulling it off inside out. The first glove you remove should now be inside the second glove. Follow our agency's procedures in disposing the gloves. So throw them away in the trash, and then wash your hands following this proper procedure. 718, guys. Practical tips. So disposable gloves should never be washed or reused. Always replace if it becomes ripped, torn, or contaminated. Always wash hands before and after. Know our agency's policy for disposing gloves. Policies may differ from different agencies. Wear gloves that fit properly, and if you have the wrong size, they can tear or fall off. Don't forget, contamination can happen when touching unclean areas, the wrist, or other surfaces. Placing gloves on contaminated surfaces or in your pocket. Removing gloves. You must wash hands when you remove or replace your gloves, and long nails can puncture the gloves. A general rule, touch the outside of the glove only with another glove. Handling disposal and infectious wastes. In a person's home, you may see syringes, needles. They can be used for the individual for certain medical conditions. These are called sharps. So we call needles and syringes sharps. And there need to be disposed of properly. Do not touch sharps, for example, syringes, with your bare hands. Use glove and a possible tool to pick them up. Sharps need to be thrown away properly so nobody is injured or infected with these, such as the garbage men. And ask your supervisor if you're responsible for disposing of sharps, and then yes, follow the California guidelines. Use a purchased medical sharp container from the pharmacy, or if your healthcare provider offers this to you. But some other things that you can do to get rid of sharps are, we've seen people take like a coffee can, and you just cut a little top, you have the top and you just cut a little mark there where you can put the sharps inside, but then you also want to take duct tape and tape it around as well. But you want to make sure it's in something that is it's not gonna fall out. Someone's not gonna accidentally puncture themselves, and you're gonna want to write the words non-recyclable on the container with a black marker. This helps ensure that the container will not be advertisingly mingled with recyclable materials. You want to fill the sharps container approximately 3/4 full, and do not overfill the container. Keep out of reach of children and pets. And when full, use a heavy duct tape to secure the lid to the container, such as duct tape or electrical tape, then throw it away with regular trash, always washing your hands after handling or touching the sharps. Handling the waste of other sharps. Body waste, such as urine, needs to be flushed down the toilet. Soiled incontinence pads or disposable gloves need to be placed in plastic bags, tied and taken out with the trash immediately so that it does not create odors or grow bacteria in the home. And mop water needs to be flushed down the toilet or thrown outside. Never put it down the kitchen sink. 7-18, linens. If feces or vomit is present in laundry, put on gloves. Put linens or clothes in a plastic bag. Do not put them on the floor, and put them into the toilet. So if you have a client and they unfortunately soiled their linens, or they had a bowel movement, take that sheet and dump it into the toilet. So you get the feces off the blanket. You're not going to want to take that blanket and just put it into the washer. You want to get the feces off it first. Rinse off a large soiled in the toilet and put the items back into a plastic bag. Wash linens and clothes immediately and separate from the rest of the household laundry. So you're not going to want to put that sheet into the washer and then add some other clothes that you have to wash. You're going to want to wash it separately from everything else. Add bleach if clothes can be bleached. Otherwise, let them dry completely in the dryer. The heat of the dryer will kill the bacteria. Hang clothes out on a clothesline. This will also help kill the bacteria. Most of us don't have clotheslines anymore, so just make sure that when you're putting it in the dryer, you're making sure it is completely dry. That's killing all the germs before you put it back onto the bed. 7-19, cleaning the environment. Universal cleaning and disinfecting solution, which is like diluted bleach. So 1 part bleach and 10 parts water. It means that whatever measuring device you plan on using, which is like a 1/3 cup or a 1 cup or a tablespoon, you mix 1 measure of bleach to 10 measures of water. So example, you pour 1/4 cup of bleach and you put 10 1/4 cups of water into a spray bottle and label the bottle. So this is good for disinfecting any bacteria which could be present on countertops, sinks, toilets. Contact time, the amount of time needed for the bleach to work is the amount of time it takes for the surface area to dry after you have sprayed it with the bleach solution. Bleach can act as a sanitizer in strong solutions and disinfect weaker solutions. So that means that when you're spraying it, you're going to want to let it air dry. You're not going to want to spray it and then wipe it off immediately with a towel. You got to let it dry. However, remember that fragile skin can be very sensitive to bleach and water solution. If a client gets the solution is in his or her skin, eyes, flush it out with water. So before you're deciding to, use bleach in the client's home, you're going to want to ask them if that's okay with them as well. Bleach solution needs to be put in a spray bottle, labeled, and fresh supply made every 24 hours. So you can't make the bleach solution and then use it next week. You're going to have to remake it. And so now we're on the last page here. We're going to go with the did you know. Hand washing helps reduce the risk of infection. Is that true or false? Feel free to put your answers below as well. That is true. Gloves are only required when the person is ill. True or false? That is false. You should wash your hands at least for 10 seconds. That is true. You should wash it for at least 10 seconds. You need to be washing it for 20 seconds, singing the happy birthday or Twinkle Twinkle Little Star or Rihanna or whatever you sing, but for 20 seconds. It is never safe to touch another person's blood. That is true. Whenever you're in contact with somebody's blood or bodily fluids, you need to act as if they have HIV or AIDS, and you need to be wearing gloves. To be safe from infection, use bleach on your hands. And that is false. You're going to want to be using gloves. And so I want to thank everybody. This is for part 3 of the safety training of emergency situations. After you watch this video, you have received all the safety training that you need at this time. But once again, we are a company that is big on education, and the more that we can learn, the more that we can protect ourselves and give better services to the clients, we are all about it. So you're going to be seeing a lot more videos to come. I hope that you enjoy these videos. If you guys have any ideas for other videos that we can do in the future, if you have any comments on these videos or questions, feel free to ask them. And I'll look forward to talking to you guys again soon. So have a wonderful day, everyone, and look forward to talking to you soon. Bye-bye.